Started. So good morning, good afternoon, and good evening, everyone, to you all, depending on where you are joining in from. My name is Sylvester Moyo, and I'm delighted to be your host today. Today's AMR Community of Practice Echo session explores the exciting potential of interactive geographic information system maps, or GIS in short, for tracking antimicrobial resistance across the One Health spectrum. Visualizing AMR surveillance data through GIS offers a powerful tool for informing decision-making, policy development, and real-time tracking and monitoring efforts. This approach leverages the strengths of bioinformatics, data science, and multidisciplinary One Health approach, providing a comprehensive view of AMR trends across human, animal, and environmental sectors. Today, we will learn about some interesting use cases of how this innovative technology supports AMR surveillance. Please note that this session will be 1 hour long and include a question and answer segment. Throughout the session, we encourage you to share your questions and comments via the chat box, and we'll attend to these towards the end of the session. Please note that there is simultaneous language interpretation from English to French that can be accessed via the interpretation icon on the toolbar at the bottom of your Zoom screen if using a PC, laptop, or smartphone. Please click that interpretation icon and select either English or French language based on your preference. It is a privilege to introduce today's presenter. Dr. Stephen Obol Opiyo is a bioinformatics and data scientist at The Ohio State University and the co-founder of Patria Data Science based in both Uganda and USA. He has a background in GIS, bioinformatics, data science, data management, and public health, and holds a PhD in bioinformatics, a master's in breeding and genetics, as well as a postdoc in data science. He brings over 18 years of experience across public and private sectors and is really a comprehensive resource in genome editing, data science, and bioinformatics with applications in genomic surveillance, public health, and climate-smart agriculture. Dr. Stephen also actively engages in training and capacity building in Africa and has contributed in bioinformatics and data science training at ILRI in Kenya, the University of Sacred Heart in the USA, as well as Muni University and SynBio Africa in Uganda. Dr. Stephen has also contributed significantly to academic research, having published more than 50 papers in the fields of bioinformatics, pathogen genomics, data science, plant and animal genetics, as well as public health. It is my pleasure to welcome Dr. Stephen. Dr. Stephen, over to you.
Very much, everyone, for coming. Again, my name is Stephen Opiyo. I'm Ugandan, but based in the US. My topic today is utilizing interactive GIS platform for integrated solution in AMR, One Health, pandemic preparedness, and this brings synergies with data science, bioinformatics, and GIS. So this is how my talk is going to be. I'm going to introduce what bioinformatics is, what data science is, and what GIS is, and in a layman's term. I will make it a little bit very simple. And then I'll spend some time talking about how I apply this into AMR. That's take most of the time. And then also I'll talk about how we can apply this into One Health. And then I will conclude with pandemic preparedness, and then I will do some demonstration. Okay, so what's bioinformatics? So I want at least to make it a little bit simple by putting this in the kind of like a cycle. So the bioinformatics is kind of in the middle, and it has four components. The first is omics that involve genomics, which basically the genomes of the organism. And then we also have transcriptomics, that's with the genome that being expressed. We have proteomics, metabolomics, and metagenomics. So that is one component of bioinformatics. And then you go to search and compare. And under that, you have databases that we use for storing the biological sequences. Then you have the sequences that you can now maybe use for comparing resistant and non-resistant genes. You have the alignment of those sequences and then you have evolutionary study for those sequences. And then after you have the integration part. So you can integrate all these data sets. You can integrate genomics, transcriptomic, phenotype data. And then we use that to help us in our analysis. But last but not least, that we should not forget is the capacity building aspects of it. You have to train people in bioinformatics. They can be on site and it can also be virtually. So basically, in brief, this is what bioinformatics is in a nutshell. Data science, I also made this into 4 components. But data science basically starts with data. So under data, you have the collection data, you collect the data, and then you do this. You storing the data, you transform the data. Also data involves the security of the data, and then you're monitoring what's going on in the data. And then of course, maintain the data. And then in the same, you have data visualization. You can visualize your data in a graphic form, the heat map. In the word cloud means you can convert the text into the word, and then you do the maps, and then you have interaction about dashboard. Another component of data science is artificial intelligence. That's when you can have machine learning that you use for predicting and analytics. And then we should not forget about the ethical and social consideration of the machine learning. How is this being used? Is it being used ethically? And last but not least, you have the statistics and math that helps with the analysis. You have descriptive statistics that will help with the analysis, inference statistics, multivariate statistics that combine various variables. You have calculus, the probability, and also have simulation. So these are the 4 components, basically, and they are all interrelated in a very simple way that defines data science. Okay, interactive GIS platform. Again, I put this into 4 components. So the first one is mapping and visualization. So that one helps in creating the maps. You can customize the map that you created. You can add layers of data to the map. You can visualize the spatial information or geographical information. That is mapping and visualization under interactive GIS map. Then you can integrate those data with other systems. You can integrate the data, databases. You can integrate it with other data sources. You can integrate with other services. And then you have the user information, interaction, collaboration. You can zoom the map that you've created. You can have multiple users work together. You can, the last but not least is data analysis management. You can do the analysis, you can do spatial data analysis, you can do network analysis, you can import and export your data, and you can organize your data. So I wanted first to introduce the 3 components, the bioinformatics. I presented them into 4, and then data science, 4 components that make data science interactive GIS platform. Okay. So from now on, I will now go to my real presentation. And each time I present, I'll start by a brief history or why I worked on that. So the first one is the integrated solution in the AMR using Vivli data sets. So this Vivli is an organization that is sharing data from pharmaceutical companies and diagnostics or lab. So what these companies have been doing for the last almost 15 to 18, 20 years, they've been collecting MRI data as surveillance data. So what they did is now they have this organization that store this data from. So if you go to this organization, they can give you this data and then you can work with the data. So last year, they wanted to at least make this as a competition. So they had this competition called Open Reuse Data Challenge, which was funded by Welcome. So 5 of us, 5 Ugandans, we decided to apply for this competition. So I'm a data scientist and bioinformaticist. I'm based in the US, where the pharmacist was based in UK and the 3 medical doctors were based in Uganda. But to be accepted to this competition, you have to submit an abstract of 300 words and tell them what you're going to do. So we brainstormed and we realized we are both from Uganda. What we're going to do, we're going to work with Ugandan data to do for this competition. And then when you went to their website, they give you summary of the countries that they have, type of microorganism and type of antibiotics or antifungal that they have. To our surprise, we didn't find Uganda. So we had to rethink, okay, now since we don't have Uganda, what can we do? So we said, okay, now why don't we use Kenya since Kenya was there? So we use Kenya as we're going to work with Kenya, and then after that, we're going to infer that. So we say we're going to use machine learning to work with Kenyan data, and then after that, we can infer that to Uganda. So we submitted our abstract, it was accepted, and then we're given data from Pfizer called Atlas. So what's Atlas data? So the Atlas from Pfizer means antimicrobial testing, leadership, and surveillance data. So this data has 18 years. They've been collecting this data for the last 18 years from 2004 to 2021. It had 83 countries, 345 species, and more than 800 isolates. And then, of course, they gave us in the form of spreadsheets, more than 800 rows with 126 columns. And we were really excited. Okay, so now we went to the data science part, because when you get data, you have to go and do that, see what's in there. So then this is basically how the data looked on the spreadsheet. On the left, you have the rows. On the right, you have isolate, the family, and then the antibiotics. So now, after going through, we encountered such challenges. So first of all, we could not go through all this through the spreadsheet. That's one challenge that we had. The second challenge, we were interested in working with data from Kenya, but after doing the preliminary, we realized that we have only three years, and they were not even consistent. We had 2013, 2014, and 2021. And then we also, when we checked, there was no data from Uganda, but now they added data from Uganda. So Uganda had 2021, only one year. So okay, then we said, okay, since we have all the data from 3 years from Kenya, why don't we try now other countries in Africa? This was another challenge. There are only 13 countries out of the 83 from Africa, and most of them had fewer than 5 years, and they were also not consistent. We were stuck. So the best, what we said, okay, what can we do now? Since our first objective, we wanted data from Uganda, it wasn't there. Now we have only 3 years from Kenya, and we have very few data from Africa. So then we brainstormed, and then we said, okay, let's now come with a solution here. So from now on, I'm going to talk about what we did after having these challenges. So we had 3 objectives. The one was first to develop interactive GIS dashboard for all these countries, so that if in the future somebody wants to use the data set, you can tell them what they have in a real time. Secondly, we're going to create interactive dashboard for specific to Kenya and Uganda, and go into detail and see what's in there. And last but not least, and we are going to simulate data for Kampala, and then see what we can do. So these are the group. So this is the pharmacists in the UK, and these are the Ugandans that we work with. And this paper was published by the Welcome. Okay, so again, that's what we were given. So this is what we got. So I'm going to explain here. So from the 863,000 rows, we developed interactive dashboard. So the dashboard now, it has the country, and also we divide it into regions. We have all the isolates, and now we have the countries. And now you can go to this dashboard and you click on a country or a region will tell you exactly how many years that country has and how many isolates they have. So this is Uganda. If you select Uganda from the dashboard, is from Africa, you have 2001, the year, and the 76 isolates, and you can see the country here, Uganda. Okay, went to United Kingdom. United Kingdom is in Europe, and it has all the 18 years and 14,127 isolates out of the 800,000. And then now, Africa region. We selected African region, you can see only Africa, and you can see from the map, you can only see only Africa, and it's the only 13 countries that we have. And out of 800,000, more than 800,000 isolates from 2004 to 2021, there are only 22,000 samples from Africa, isolates from Africa. So at least our first objective was solved. So now you can go and use this. If you want to do an experiment, you can select a country, tells you if they have, how many isolates they have, and also the years that the data has been collected. Okay? Okay, second objective. So now it's okay. Now we have those data from Kenya and Uganda. We're not going to throw them away. We're going to go now into details and see what's going on. Okay, so again, for the spreadsheet, so this is now Kenya and Uganda. I'm going to show you here. So now this is Kenya and Uganda data. You can see this is the samples combined Kenya and Uganda. We have 722 samples. So this is Kenya and Uganda. And of course, Kenya had 2013, 2014, and 2021, and Uganda had only 2021. And now you can see the pathogens are here, the sources where the samples came from, and you can see now you have our antibiotics here. Now you can go and start doing some analysis, okay? Okay, for example, if you pick Uganda, if you select Uganda, any information from Kenya disappears. So you go to Uganda, we're going to see E. coli here. So E. coli, these are the sources where they came from. And of course, you can see Uganda had on 2021. And I would like you to follow this. These 21 samples, if you look at these red circles, they were resistant to these antibiotics, this one, but they are suspects, all of them were susceptible to these antibiotics. Now you can start using this information. We did the same for Kenya. Now, if you go to Kenya, all the information for Uganda will disappear. Again, E. coli, the sources, and you remember Kenya has all three years, 2013, 2014, and 2021. Again, you can see these are these 41 sample resistance of these three antibiotics and susceptible to this. So this was our objective too. Okay, now we use the information now simulated data from Uganda in Kampala. So the Kampala, we simulated data from 7 regions. These are the region from 6 regions. This is a region from Kampala, and then there's our region, and our similar we had 670 samples. So we picked one region, this which is Lugala, and then we picked this. After picking one region, you can see that this microorganism is only found in Lugala. You can see from the map. And then you can see there was no information on these 2, but you have information on ampicillin and also so you can have some are successful, some are intermediate, but we were interested in only resistance. So you can see the source here we have from respiratory and urine. But now if you go and pick only the resistance one, you can see only this one. There are 2 samples, and this came from where? From only respiratory. So you can use that such information in real time. Okay? Okay. So what are the impact of this? From the spreadsheet, now you can, in real time, this dashboard is compressive, and so it can design for AMR analysis and exploration, as I showed you. suitable for researchers, policymakers, and healthcare professionals. You can also add other information like demographic and other things. It has wide functionality, provide access to healthcare, public, and demographic, and so forth. It's centralized hub for easy access and analysis in aggregating and organized data sets. It can be used for exploratory and analysis, allows users to perform complex query that I showed you, and also in-depth analysis that was we did in Objective 2. It is enabled to explore pattern, trend, also correlation among multiple countries and regions. I showed you that in Kenya, and then also I showed you for the simulation. You can do cross-country comparison, kind of get the similarities and differences between countries. For example, when we did Kenya, for the real data from Pfizer, we had, for E. coli, we had some that were resistant to antibiotics, and some of the same that was accessible to other antibiotics. You can support impact and intervention in specific countries. You can support also decision making. So policymakers can use such information to help them to allocate resources. Okay, so also aid in developing evidence-based practices, policy, and intervention. Also, it's also empowering through data. So as I mentioned, you can use this data across multiple countries. You can also add other information, and also it's improve the research worldwide, because when we first started, we almost gave up, but we came up with a solution that can be used by anybody in the world. Okay, so that was AMR. So this is another story here. So next is integrated solution in One Health. So these are my collaborators, Dr. Christian from ILRI, and then Nguyen Agro Venture, and also Peace for Magma. So we met and we discussed, because Christian is work with animal, the challenges of animal breeding in Africa region. So these are some of the challenges of poor administrative organizations, the climate change, lack of standard operation data, lack of breeders platform, low rate of investment, lack of long-term plans. But we were interested in the One Health implication. So that's what we're going to work on using what? Using the dashboard. Okay, so because of the challenges, the African Union have this center of excellence for the seeds, of animal seeds. So they are in 5 areas, 5 regions. In West Africa, we have Burkina Faso. In South Africa, is in Botswana. In East Africa, we have in Uganda. Central Africa, in Cameroon, and North Africa, we have in Tunisia. So if you're going to have seed centers, you're going to have these seeds, and then they will be distributed. So we came, how do you track these seeds and then that pathogen associated with the seeds? Because you're going to get these seeds from different areas. Okay, so we simulated data from some African countries. In ours, we have the breeds, animal breeds. So we have the breeds, we have cattle, donkeys, so pigs, chicken, and so forth. And we have the breeds, the Jersey and African catfish, local, depends on the livestock. And then our seeds are the dams, the old chicks, embryo, and semen. And then the pathogen we're going to work with bacteria, fungi, viruses, and the source of pathogen, of course, One Health, environment, human, plant, and animal. Okay, so how can you track this? So we came up with a dashboard. You can have the country. So these countries are in this map, you can see them. You have the livestock, you have the breed, you have the animal seed, you have the pathogen, you have the source of data, the source of the pathogen, and also the region. So now you can track if you are trying to distribute this seed. For example, this is just a simulation. We had pig as a livestock. The breed was land-raised pig, and the seed was semen stacks. and the pathogen was bacteria, and the source was human. And this were distributed to 2 countries, Sudan and Central Africa, came from this region. We also went further. Look, I assume this is just a simulation. I'm not trying to say this in particular country, but we also went into detail of the country. So I assume this seed came from, I assume this seed came from Kenya. So in Kenya now we went into detail at a county level. So we have a county. Again, we have a livestock, we have breed, animal. Of course, these are the region now. You can see in the map, genetic pathogen sources. And then from here, you can see that the county where this seed came from was Migori. Of course, the seed is the pig, and then the breed, and then also where the pathogen came from and the source. So this is just for simulation. So using this GIS dashboard, you can track this, okay? Okay, so basically, we demonstrated that you can use the GIS platform to track genetic materials and also with associated pathogen. And then this platform can be used for the regions, and you can also be used for countries. And we did simulated data from Kenya. Okay. Okay. Last but not least, I'm going to talk about pandemic preparedness. So again, I'm going to start with the history. So in 2022, we got some funding from Open Philanthropy, and they gave us funding through Seen by Africa for global catastrophic biological risk. And we had workshops in whole of Africa, and we divided this into 4 regions. So we had one. We combined East and Central Africa in June 2022, and then for North Africa, September, West Africa, November, and then February. Last year, we finished with the workshop in South Africa. So these are the team. I was their project consultant. So this is Geoffrey, and these are the team. So in the workshop, we identified information that is required for developing a warning system for pandemic preparedness going through this workshop. So how are we going to develop this? So the key concept, develop a rapid warning system for detecting, preventing, and responding to biological risk. So this has to use a One Health approach. So to do that, you have to do a One Health approach. And we're going to use geographic information systems to track this approach, okay? So these are the requirements. You have to have source of data, and these are the source of data. You have to map. The metrics can be reported cases, patient symptoms, One Health, human, animal, environment, genomics, climate change, and the rest. And then you have to have social biological risk. Can come from community, laboratory, wildlife, engineered, and others. You have to have technology, tool for testing biological risk, biological reagents, computer databases, and so forth. And you have to have human resources, that the skills you need to do that, from technician to public health official, wildlife official, veterinary medical doctors, people in plants, and so forth. You have to have capacity development, the courses you need, workshop, and so forth, and you have to have collaborators and stakeholders. So these are the requirements in developing a rapid warning system for pandemic preparedness and One Health approach. So this is in table form. The same can be put in a figure form. It's a rapid warning system, detection, prevention, and response, technology, capacity development, source of data, social biological risks, collaborative. Okay, now you can do this in real time. You can have a country, technology, capacity development, biological risk, source of data, potential risk, source of biology, and so forth. Okay, so I already went through this. So let's take example, one country, Comoros, and we're going to do some maybe work there. So if we want to know, we have to have information. I'm just going to take the capacity building from the Comoros. This is just simulation. How many people are trained in bioinformatics? How many are trained in biosafety and biosecurity? So this will help us in case of when we want to do the rapid warning system and other information. Okay? So what I'm going to do now, I'm going to do demonstration to put all this together now. I'm going to use real data from South Africa, and this data came from Pfizer, part of the one that I started with. So I'm going to stop sharing my screen, and then I'm going to start with the data set first, and that's going to be part of the data science. Then we'll go after going through the data, then we'll go to convert that data in real time into the platform. And then after that, we'll see how we can use that platform now. We can trace patterns. We can even do get those samples and maybe have something to do with bioinformatics, okay? So let me stop sharing and then I'll come back with the data. Do you see my screen?
Yes.
Okay.
And next sheet.
Yes, thank you. So this is how we were given the data by Valvoline. So this is the data from Pfizer. They've been collecting this for the last 18 years. So with the ones that are shaded yellow with red fonts are the ones that they're going to be on the dashboard. So isolate HID because this is very important because if you select and isolate, you go back to Pfizer, assume they store this isolate and you want to do some experiment. So I put this, these are the, because when you're working with GIS, you need coordinates. But Pfizer data doesn't have coordinates. So this is where data transformation comes in. So we had to do the transformation. We had to add the coordinate. So all those maps that you are seeing, the coordinates that we use, we got them from Wikipedia. So each country, the coordinate is the coordinate of the city. So if you go to Wikipedia and type a name of a city, they'll give you a coordinate for that. That's what we're using. And then, of course, these are the spaces, gender, source of data, and then the year. And of course, they have age group, but for this illustration, I'm not going to show this. And then these are now the antibiotics. So where does data science come in? One is Pfizer is using that for collecting data every year. I got now the latest. I got that last week. So every year they collect this data. So that's what part of bioinformatics. They updated. That's part of bioinformatics. But you have last year they had 800, I think 60,000. The one I got last year, they've gone now to 900,000. And Kenya now has four years up to 2022. Uganda has now 2 years. So to go through all this just through spreadsheet is daunting. Okay, so that's part of the data science part. Now I'm going to stop my screen again, and now I'm going to go to, we're going to present this data now in the part of GIS platform. Okay. Again, do you see my screen?
Yes, yes.
Okay, so this is what I just discussed a few minutes ago is now presented here. So these are the microorganisms, these are the species, and we had 12,947 samples, and these are the isolates ID. And this is the source of information that the samples come from, and these are the years. So South Africa, the luckiest in Africa, they have 17 of the 18 years. the only year missing for South Africa is 2010. And then these are now the antibiotics. So what I'm going to do, I'm going to show you how we can use this platform now instead of going through the spreadsheet. So I'm going to try to find out of these samples, how many of them were resistance, multi-drug resistance. So let's start with this. Select resistance there, resistance here, resistance there, resistance here. So there are 15 samples that for resistance. And you can see they came from all these sources, and they're from 1, 2, 3, 4, 5, 6 microorganisms. So if I click on this, only one sample from that, click on this, only one sample from this, only one, we have 11. So this is now where bioinformatics come in. So I have 11 samples from this Trapezius pneumonium. I can now go to this sample ID and ask, can I get these samples so we can sequence them and see what happens to them? So to do comparison in the omics, now I need this also susceptible, the susceptible samples that are susceptible to these drugs. So I'm just going to leave this here, and I will now go back and I'm gonna go back and just select only the ones that are susceptible. So I have this one here, I have this one here, this one here, this one here, and this one. So these are 9 samples now. So I can now go and do my bioinformatics omics. I can do all the omics, do the experiment, get those for resistance, and now you can do the alignment, work with the genes, work with the metabolomics, and so on and so forth. Because all these samples that were suspect to this, these are the isolate ID. And I can now go back to files. I said, okay, let me do that. I need that. Another thing that I'm going to show you is, I'm going to go back. Let me reset this. Okay. So these are the 12,000, almost 13,000 samples. I want to see the resistance for ampicillin for every year, the proportion. So let's start. I just go to ampicillin resistance here. Let's start in 2005. We had 279 samples that were resistance, okay? So let me go back here. Let's go back to 2005. Okay, this is what I did. In 2005, they collected 713 samples from South Africa. Out of these samples, 279 were resistant to ampicillin. This way, I did the proportion that was around 37%. Okay, let's just pick another random one. Let's go to 2021. In 2021, there were 340 samples that were resistant. And how many were collected? 1,005 samples were collected from South Africa, so 33%. So I went through this at random, and most of this, there's no pattern at all. But if you look through all of them, the percent of resistance around between 33 and 39%. Let's take this, the lowest was 2009. Let's take this one here. So in 2009, they collected only 102 samples from South Africa. And what see the ampicillin resistance around 34. So you can see you can now start using this, okay? So that's how we can use this, okay? So let me now stop sharing and then I can finish my talk. So before I finish my talk, I would like to acknowledge a special start with SLMM for inviting me to present this, and then the audience, the ones who are listening to this, because without audience, I would be here. And then, of course, part of this presentation is based on research from Atlas, Pfizer, who are very, very kind to share this data. And then, of course, the team from WebLi who gave us the data, and they welcome who sponsored this. And my collaborators from Magma, Peace, and Christian, and my co-authors. And then these are my collaborators and funders. And thank you very much. With that, I can take questions. Thank you very much.
Thank you very much, Dr. Stephen, for that. That was really a fantastic presentation. Your insights have really truly illuminated the power of interactive GIS maps and how we can use them. So thank you so much for sharing those different use cases. In your presentation, you've also highlighted how the GIS mapping can really empower data-driven decision-making across the sectors. And that's really something that we want to see more countries doing in terms of using the One Health approach. So by enabling in-depth analysis of AMR trends alongside, you mentioned healthcare data, public health data, and also economic data, I think this is really important as it can help policymakers evaluate the interventions and also develop some evidence-based strategies to combat AMR, both at the local and also at global scale. So we will move on. I think we have some questions and comments in the chats. So we'll start with some of the comments and then move on to some questions. Hopefully we'll have enough time. So I think the first question that I have on the chats is from Oluwasem, who is kindly requesting for a link to the Patria dashboard, Dr. Stephen. So maybe if you're able, you can either maybe respond to that and then we can share the link if that is possible.
Thank you for that. Thank you very much for that question. We have the link. We have a paper that we publish, and the link is in the paper. So I will share the link with you after this, okay?
Sure.
Okay.
Thank you very much. So we also do have follow-ups, I think, related to the same question. We have one from the question from Mariamo, who asks, how reliable is the data in the dashboard, given that African regions are not updating this data periodically?
So that's a very good question, and that is that is the dilemma that there are scientists and bioinformatics that work with, because you have to work with the scientists who are getting the data. For this one, we trust that Pfizer, who gave us the data, did a due diligence with the data. So it depends on where the data is coming from. Thank you.
Right. Thank you. So we have, I have like 2 questions coming from one participant. Please forgive my pronunciation. I think it's Ayorinde. And Ayorinde or Ayo has actually asked 2 questions. The first one is that they are really, interested in doing something similar in the future. So they are asking about what tools that were used and what programming language. So basically about the back-end code that was used for generating the plots and whether this code is accessible.
Okay, thank you very much for asking that question. Okay, this I use Israel, which is a GIS platform. But if you read our paper, all the process of doing that is in the paper. You can use a platform called QGIS that is open source. So if you read our paper, we have all the methodology. Well, the only thing you need is just use the QGIS, because Esri is proprietary, so they have their own codes that they use. I think it should be Python, but they change a little bit, so I subscribe to that. But I will also send you a link to the paper. We describe what we did, and you can use a QGIS. That's an open source. Thank you.
Thank you very much, John. We also have a similar question coming from Bongani, who asks, is the database freely accessible to be used to train other related models, and also which approach works best in handling data imbalance, especially looking at how you went about it. And then since this is cumulative data over the years, and how best did you handle the missing values in your data and cleaning process?
Okay, thank you very much for the question. First of all, this data is a third-party data. You have to go through value. You apply, and then you give them the reason why you want to use the data. Then they will give you the data. It's not open source. But what I did was I used the data, put in the dashboard. The dashboard is, you can use the dashboard, but you cannot get the data because the data is for Pfizer. You have to get permission to do that. Okay, to answer a question about the missing value, we did not do any in-depth analysis like where we could have to work with the missing value. You see, we had three objectives. One was to make these data sets be easily accessible to give you the information. Secondly, was to see how from Kenya and Uganda, if you take a sample which are resistant to different type of bacteria. And thirdly, we did simulation. So we didn't go into in-depth analysis, but in the future, that's what we plan to do. Then we can now try to work with the missing data. But for this project, we did not go into deep statistical analysis. Thank you.
Thank you very much, Dr. Stephen. We have a comment that is in French, and I hope that this has been answered. This question is coming from Adama Simpore, who asks, how will we be able to obtain this tool? Will there be a training session on its use? I think, Adama, we will share the link to the tools that we used, and as much as training sessions to be on this, I think maybe Dr. Stephen, I don't know if there's a platform that's already there where maybe people can, access the resources for training virtually.
There's a link to the dashboard, which is really very easy to use. But if somebody needs some training, we'll be happy to help with that. But it's very easy to use.
Great, thanks. Really, I'd like to appreciate Christian Tiambo, who's just expressing gratitude to you, Prof. Stephen. Says CTLGH ILRI and Green Gold Agro Ventures are always very glad working with you. Really appreciate that, Christian.
Thank you.
We have another question, I think Oluwaseun. So just to let you know, I think Oluwaseun is just asking how we get the paper, will it be sent per email? So we will also share, I think as part of the recording and other resources, we will share this after the session. We have a comment and a question from, apologies if I hope I pronounced this correctly, Nyiri Miriam Giang. Who says, well done, Dr. Stephen. That was a great presentation. The data presented shows that there is a serious AMR research gap in Africa. What measures have been put in place to build the capacity of healthcare professionals to adequately diagnose AMR and to publish findings?
Yeah, that's a very good question, because when we went for this, we were shocked to find out that basically, I don't want to use part ignored, but most of this work is not being done in Africa. I'm a bioinformaticist, I'm a data scientist. I cannot answer that question, but it's right, there's a big gap. And if you read papers, most of these problems are in sub-Saharan Africa, but nothing is being done. I could be wrong, maybe we have data somewhere, but they're not being used, or maybe using dashboard like this, we can get those data and share with people, but we need some work on that. Thank you.
Thank you very much, Prof. Stephen. So I think we don't have any more questions that I can see on the chat, but I was just interested, I think in the first use case that you highlighted, you know, you went in with the team, you had a certain research question in mind, but when you, after seeing the available data, you then had to, you know, pivot and see what other things you could do. Just interested in what, I know it will be in the paper, but maybe to share what kind of tool or application, AI application that you were actually training for the benefit of the audience.
So what we're trying to do, because we have those medical doctors in Uganda, they have some data that they've collected from the hospital and from the university. So what we're going to do, we're going to train, we're going to get data from Kenya. We're going to train the data using machine learning algorithm for basic classification algorithm. And those models, we're going to try and see if we could predict resistance or antimicrobial use using data from Kenya. If the models we train can work on the models in Uganda. So that's what we wanted to do, really. But we didn't have enough data.
Great. Then another question, I think there was a use case where you showed, you know, how you could track, I think you called it animal seed, which is a new term for me that I'll take from this webinar. I think you were showing how, you know, you were tracing AMR using that. Just to also maybe ask in terms of the application for that, were you just trying to, you know, trace where potential contamination is coming from, and what other uses can countries maybe make of that?
Is Dr. Christian still around? Maybe.
Christian, please. I'm not sure, but I hope he is. Dr. Christian, are you can please go ahead and unmute yourself if you are.
Yeah, I'm around.
So maybe he can help me answer that because he's my collaborator.
Yeah. Thank you very much, Stephen, and thank you, everyone. Yeah, I know many people are not used to animal seed, but it's still like in plant where we talk about seed, whatever we use to generate the material for breeding, for development. It can be semen, fertilized eggs, embryos, etc. Everything that is important to start your breeding flock or your herd, etc. So, and most of the time, these material are cryopreserved in the regional gene banks, national gene banks, etc. And the essence of this work is just to ensure that as we are cryopreserving the material, or let's say sperm or semen that is used to disseminate a breed, we are not also disseminating pathogens associated to the different genetic resources. So the essence is just to ensure that when we screen, and we work in collaboration, of course, like with institutions like AUI, who developed the regional gene banks, as Prof. Stephen mentioned, but also with other national systems and the Department of Veterinary Services, local labs in the regions, to be able to pick any pathogens associated to semens, etc., in the different diagnosis lab, and they can be loaded in the platform, and we can trace it using the platform Stephen mentioned, just to be able first to know about the disseminations of the animal breed within the countries, and this will be helping a lot the country breeding programs to know what is there exactly and how is performing in the agroecologies. But also if there is introduction of a disease, a pathogens, etc. in the regions, the same platform connecting to a kind of situation room or whatever we saw during the COVID, for example, when we are monitoring and tracking COVID, we can also use it to track pathogens associated to livestock, genetic pathogens, zoonotic pathogens, etc. So this is a simple idea, but it can only be implemented if we apply the tool that Prof. Stephen is developing, and it will really be helpful for Africa in general. Yeah, I hope I've responded to the question. Thank you.
Yes, thank you so much, Dr. Christian, for that. I think there's a poll going on. If you would be so kind as to just indicate or participate in that poll. In the meantime, I think on the screen, we are also just, highlighting the certificate, how you can download your certificate and the code there. We will also just share that as an email together with a video and other resources that you have requested during this session. So thank you so much again, Dr. Christian, for being available to also just jump in and contribute. We really appreciate that. So
You're most welcome.
thank you. So due to time consideration, I really would like to take this time to thank all who have shared their comments and questions. Also just noting a comment from Nadine Abiola, who says they would really be interested in using this tool in Cote d'Ivoire. So there you have it, Prof. Stephen, generating much interest there. So at this time, really, I would really like to offer a few minutes to Dr. Stephen to give some closing remarks or comments.
Well, thank you very much for everyone for coming. And as I mentioned before, I'm a Ugandan, and my passion is capacity building for Africa. Last year, I went to Africa 5 times. So somebody mentioned that we still have gaps, and I would be happy to work with collaborators in Africa. We'll be happy to train people, and I'll be happy to share my knowledge. Thank you.
Thank you very much, Dr. Stephen. Really, I think this has been a wonderful session indeed. We really appreciate your availability, Dr. Stephen. I'm sure many people will also try to share your email address because I'm sure there are a lot of people that are eager to reach out and find out how you can help them. We'll also try and share the different calls from Vivli, the one that you've highlighted, so that those that can be interested can also take a chance and apply for that. As always, really, we are always looking for ways to expand your knowledge base as our participants. So please stay tuned for an upcoming AMR CoP webinars on even more topics. Please, as you register, I'm sure you also see where we ask for what other topics you'd like us to explore on this platform. So please, we will be taking a look at that and bringing you what you would also like to see. Otherwise, really wishing you all a great weekend ahead. Until next time, it's goodbye for now. Thank you. Merci beaucoup.
Bye-bye.